Hello, hello. Welcome, Good Gut Gang. For those who may not remember who I am, I'm Delia Marin, an integrative registered dietitian, certified gastrointestinal nutritionist, and one of the co-hosts of the Good Gut Live podcast. And this is just something we love, love, love when we have incredible guests on our show who have different passions and have such a breadth of knowledge and topics that intersect with your good gut and the gut microbiome. And one that we talk about so frequently, we get asked about so frequently, is the vaginal microbiome. So I thought, who better to bring on than an incredible integrative OB and integrative physician? And I will let you introduce yourself, Dr. Roelands, so people get to know who you are if they aren't already familiar.
Thank you so much for having me. I'm excited to be here and talk about all things women's health, which is a passion of mine. And I'm a double board certified OBGYN and also integrative medicine. So I finished the 2-year fellowship at Andrew Weil, but I'm also functional medicine trained, North American Menopause Society trained. So I do a lot of women's health stuff. And I love talking about the microbiome because, gosh, how much have we learned in the last 10 years about the microbiome everywhere, so including the vagina. So I think this is a very cool topic to discuss.
Yes, we are looking forward to it because we're starting to see that there's more people talking about it. The gut, thankfully, is no longer taboo. Stool, gas, we're starting to talk more about the vagina because we have all those things and we need to talk about them so that way we know what's normal, what's abnormal, what should be expected, what is not to be expected. And so these conversations, at least to me, are just so important for people then to know what to take back to their care team, to know that they can have new members on their care team, and just learning more about their bodies. So I'm excited about this. And one thing that I always like to kind of educate on is the overlap, because I really don't think people realize how one biome influences the rest. And we know these biomes are these collections of the microbes, their DNA, their genes, and people don't often realize how your gut microbiome can affect your skin microbiome, or can affect your lung microbiome, can affect the vaginal microbiome. So I would love to hear, just in your functional, your integrative, your traditional training, what you have learned at that intersection and how the bugs themselves affect one another, the byproducts of the bugs and how they affect their environments, and things that women may experience if the bugs, the microbes, their genes are off.
Yeah, I think in functional medicine, we focus so much on the root cause, right? The root cause of why someone is feeling poorly. And if you find the cause, so for example, if you're thinking of insulin resistance and blood sugar balances, and it causes disruption in the gut microbiome, it's going to cause the same issue in the vaginal microbiome and other microbiomes. So a lot of times in our world, when we're helping patients, we don't just see that one problem in one area of the body. That's the reason why they came to us to begin with, because for my world, they come to me and say, well, I not only have crazy periods, but I'm also have terrible anxiety and I have bloating and I'm getting yeast infections. So you can see how they all sort of tie to this underlying problem that often affects multiple areas of the body, which of course is going to affect multiple microbiomes as well. But interestingly, the gut for women's health is critical. We have the estrobolome, the part of the microbiome in the gut that specifically metabolizes hormones, and we're talking about estrogen in particular. Then you can't really have normal functioning hormones if you have a gut that's off. There's no way. This comes up sometimes in my perimenopausal women who I give hormone replacement therapy and they're still struggling with lots of symptoms, because it doesn't matter if I gave you more hormone, if your gut is not metabolizing it appropriately, it's not going to go anywhere. We're going to still end up in the same pathway. So you have to take into consideration, even when you're talking about hormones in general, that the gut, the vagina, the oral mucosa, all of these are intricately involved in overall your treatment plan. And so and that's why a lot of us who practice in the space also think about other areas as well, right? If I give someone something for a vaginal recurrent UTI or vaginal infection recurrent UTI, I'm also thinking about their gut. I'm often asking them, do they have bloating? Do they have food sensitivities? What is their diet like? Because it affects, ultimately, is this bacteria colonization going to get better, or am I going to end up right back where I started after you got treatment? So it's all intertwined, not only with production and metabolism of hormones, but also just overall the health of those particular organs as well.
And I love that you put that picture together because I think people don't really realize that these organs are so central to one another. I always give the analogy, it's almost like an apartment building. When you live in such close quarters to others, you're going to smell the food they're cooking. You're going to experience the temperatures that they have on or hear their heating and AC unit go on and off. And the same really happens within the body. We do know, microbes that are colonized in the colon, the large intestine, the rectum, which is the end of the large intestine, they very much can interact with the vaginal microbiome because they are so central to one another. So when I have patients who are coming to me because they have SIBO, small intestinal bacterial overgrowth, they have dysbiosis, and they're like, hey, I have hydrogen SIBO, and suddenly I have a Klebsiella UTI or I have an E. coli UTI. And I'm like, yeah, that makes sense. That's who's making the hydrogen in your small intestine or large intestine as well. That's who's responsible for your SIBO. They're so central to one another. They are going to impact one another. And so, like you said, taking care of one is going to help just facilitate abundant health in the other. So it's so important to
Even
know.
strange things like eyelid health, right? Like eyelid health has
Mm,
certain skin microbes that are good and bad for it. So there's so
mm,
many different like bacterial colonies in different areas of our body that we have to sort of think about it when you're thinking about treatment, especially if you're thinking about a disorder that might have multiple areas affected, like PCOS, right? We
mm.
can't just sort of go, it's just a GYN and a GYN microbiome problem. It's got bigger ramifications for the rest of the body.
Do you ever have patients who are like, I'm seeing you for OB needs. Why are you ordering me a SIBO test? Why are you ordering me a stool microbiome test? Or do you feel like people really come to you understanding that?
No, I think I usually have to do a lot of education on, so PCOS is a perfect example, right? If you're fine with talking about that, someone will
Yeah.
come to me and say, yeah, I have irregular period. Someone told me I have PCOS. But then you start asking like, well, do you have anxiety? Yes. Do you
Mm,
have bloating? Yes. Do you feel like you have food problems, intolerances? Like, yes. Do you have weight gain? Yes. Like, so then I have to connect the dots and explain how typical PCOS women have a lack of diversity of certain colon bacteria. And so therefore they're more prone to bloating and pain and SIBO and all these other sort of GI things, even though in their mind they're thinking, this is just a cycle problem. Like, this is
mhm,
just a girl irregular period problem. It's like, no, actually. And now you have anxiety because also your serotonin is made in your gut.
mhm.
And now your anxiety is through the roof. And you have sugar problems. So you kind of have to connect those dots a lot of times to say it's not just one field. That's what's so great about functional medicine in general or integrative medicine is we think about the body as a whole and not by the system,
Mhm.
not by like, here's a GYN problem, here's a psych problem, here's a GI problem. It's like, what's the bigger collation of all of these things?
What are the roots? Because we know these are just branches that are springing about. And
Mhm.
I wish someone had made that connection for me. I've shared very openly on our channels and in our community that I previously was diagnosed with PCOS about 20 years ago. And at the same time, I was also diagnosed with prediabetes and I was diagnosed with Hashimoto's. And now I'm understanding years later, after not only living it, but studying it and practicing it, oh, those were all connected at that time. And it was kind of just the standard of care at that time where it's like, here's your 3 prescriptions, see you in a couple months, good luck, instead of being like, hey, you should really work on your microbiome. Your bugs want to eat these types of anti-inflammatory foods. These are certain lifestyle factors that are more inflaming and going to make you more prone to having lifelong PCOS. It was kind of like, you have it, so you're always going to have it. There's nothing you can do about it. And now we know so differently, and we know the microbiome is such a strong piece of that if we leave it unaddressed, it's really, really hard to resolve some of those other symptoms that spring about.
Yeah, and I think we're even appreciating connection to things that maybe people wouldn't always connect, like libido, right? I did
Mm,
this fantastic video on better sex can be by having better gut health. Like,
Mhm.
I mean, if you understand that metabolism of hormones occurs in the gut, then you can imagine that you can get tanking of your estrogen, tanking of your testosterone. These things can be affected by your gut, and those ultimately are connected to libido. And so there's some things that are kind of really on the frontiers of understanding microbiome, but I think we'll find that there's so many more things connected, and even maybe there's potential that there's certain bugs that you get predispose you to certain diseases. We don't know. Like, we're still sort of trying to understand what it is to have this particular disorder and this distribution of bacteria, right?
And I'm glad you bring that up because I've been seeing more and more ads for vaginal microbiome tests. We know gut microbiome stool tests have been on the market for quite some time. How do you feel about these new vaginal microbiome tests? Is this something you use? What do you say to somebody who's come to you and is wanting one or has done one?
Yeah, so I do think there's application for them for sure. So Evie is one of the tests that I think is fantastic.
Mhm.
It's obviously has medical advisors that are OBGYNs, and I love that are good scientists behind it. I think, when you go to your standard doctor, your OBGYN, and you say, I have a vaginal infection, and they do the little swab, they're only testing for certain bacteria, right? They're only going for Gardnerella or yeast, but they're Candida albicans, but they're not necessarily like looking at the bigger picture of some oddities that might be picked up. And so if your gynecologist is astute, they may also do a vaginal culture at the same time, because they're like, well, I'm only checking for these three things. What if it happens to be these? And I'm just going to try to see if I can pick it up at the time. But if you're getting a specific test that's sort of geared towards the vaginal microbiome, then you kind of you get usually a little bit more information about what exactly in your microbiome. So I like that test. I'll use it if someone is really kind of dealing with a lot of recurrent vaginal infections or UTIs, and we really don't know what is the bug that keeps propping up, right? What is the thing? It's not in the standard kind of treatment protocol that you would do. So what do I need to do to focus specifically on that type of bacteria to eradicate it and then recolonize with the good stuff? So I do think there's some application. I don't think like every single person who feels like they have a yeast infection should go get an EV test, but or EVI, I think it's EV, but I do think it can be very helpful for trying to narrow down why this treatment not working.
I love that. And I think, for me as a provider, is it going to change what we're doing? Because if it does give us additional information, if it gives us additional insight, I think these tests are fantastic and can be
Mhm.
really good tools. I have some patients where it's like, okay, we know you have scar tissue and adhesions around the rectum because perhaps you've had a previous colon surgery. So it's, yes, let's know what bugs are there, but it's not necessarily going to always change what we're doing. So I always think that's important for people to realize as well, because sometimes I have people who come with gut microbiome tests for me as well. And they're like, I've done 5 of them. And it's like, okay, what'd you do with the information from the other 5 before wanting a 6th? Have we intervened appropriately on the information we do have, managed what we do know, and then let's add more because I think they absolutely can be insightful. Have you seen them used in the context of fertility and kind of understanding microbes that support fertility, or do you feel like that's still something we don't know enough about?
So definitely not something we understand directly linked to fertility for sure. I wanted to say something about that comment because I think that was fantastic what you said. It really depends on what the purpose of the test is, right? I mean,
Hmm.
I would never suggest a vaginal microbiome test if the person is doing things like douching every day or doing things that I already know are going to cause disruption of the microbiome. It's kind of like when we talk to someone about gut stuff, we start with the basics, like what do you eat? Like what's your usual diet? Like you wouldn't send them straight for a microbiome test of the gut if they're eating McDonald's every day. It's like, let's work
Hmm.
on that first, and
Yes.
then we'll talk about that. So same thing with the vaginal microbiome test. I certainly kind of go through the usual stuff, like are you wearing gym shorts all the time and not
Hmm.
changing them? Are you spending a week in Cabo and getting problems? Are you using latex condoms all the time and maybe you have a latex issue? Like the kind of the first things, the foundational vaginal health kind of ideas. Is the pH usually acidic? Before we kind of go down that rabbit hole of doing a vaginal microbiome test. But I certainly think it's useful if someone is kind of getting treated over and over again, because it's not helpful for us to eradicate everything all the time either. So
Hmm.
sometimes in Western medicine, you keep going, and I see these patients who are like, yeah, they put me on 12 weeks of diflucan, and now I'm on my fourth round of metronidazole, and I'm like, geez, like you killed everything.
Mhm.
So, and especially if they're checking oral, right? Because then now they're doing even more destruction to other places. So I always kind of want to then really kind of narrow down our focus, because I don't want to end up making things a lot worse by
Yes.
them continuing on months and months and months of the same antibiotics and yeast medicine, when we need to kind of hone in. Maybe we have a Klebsiella or an E. coli or something that should not be there, and we need to focus that treatment on that specific bug. So I think that's where those can be very, very helpful to help someone when you're talking about the harm from so much treatment versus the answer.
Yes, I love that you say that because we see the same with the gut that sometimes, yes, you do need that eradication. You do need the antibiotic, the antifungal, the herb that's going to get rid of someone. Sometimes you actually just need a probiotic and a bouncer to kind of outcrowd them instead because I think people often overlook that yes, you might get rid of a little bit of that species that you want to get rid of, but you also are probably going to predominantly rid of some of the commensals, the helpers, the anti-inflammatory bugs. So being really cautious with that and getting expert opinion is so important because I know I've seen people with their gut at least get themselves into really hard places because they're like, yeah, I self-ordered a stool test. I took some grapefruit seed extract, which is so strong, and then my gut's never been the same. So that's kind of like what you're saying with the vaginal microbiome that you want proper intervention, but you don't want to overdo it.
Yeah, and to be honest, I think nowadays there's so many products that people try to sell for vaginal stuff that is just crazy. Like, we don't need gummies to make it taste like pineapple. I'm sorry. Like, I don't know. Like, there's sometimes I think there's so many things that I think there's sort of this stigma that like it should smell beautiful like roses, and there should never be any of these changes. And like, I just think it's just a way for these places to market and sell things to women and to make them feel bad that like, it does have a smell. Like the vulva and vagina do have a smell. Like, that's okay. Like, nobody smells like pineapples and gummy bears. Like, that's okay. So I think that's important that we also kind of do the education too about proper vaginal health. And that way someone does understand when something is really awry versus like, it's okay, and feel like this is who you are. Like, that's okay too.
What are some of those red flags for you as an OB where you're like, okay, that's normal, no problem. This type of odor is normal. This type of discharge is normal versus what would be considered abnormal and something that you would want to look into more or intervene on?
Yeah, I mean, most women, when they start going through puberty, have clear or whitish discharge. They know it's in their underwear. Then that just a little bit that happens. Certainly, different parts of the cycle, you have more or less. When you start having like coloration to the discharge, like green or yellow, that's not typically normal. When you have, and there is sort of like your normal smell, right? You kind of know when you start going through puberty in your early 20s, you're like, yep, this is kind of my normal smell. But when it sort of becomes more musty or fish smelling or just kind of off, then, and especially, it's rare that someone has a vaginal infection. They don't also feel kind of irritated, like
Mm.
bothered, like inflamed, like they have other things besides just discharge that kind of bother them. And so then it's appropriate to go see someone to see maybe you have a yeast infection or bacterial vaginosis. And in general, the pH should be acidic in the vagina. And so this is why we strongly discourage women from putting things in the vagina, because then you know, back in the day, your mother and my mother used douching, because douching was a
Yes.
thing where they had these little betadine douches and they flushed stuff out. But the vagina is a self-cleaning organ. It has an amazing ability to take care of itself. It's like your self-cleaning oven. Like, you just need to keep it clean and it will take care of itself. So we need to stop putting things in there.
Mm.
Um, Certainly douches are definitely, because it washes out all the good bacteria. You're washing out the bad, but you're washing out the good. And
Mm.
then all that has to go back and get recolonized. And that, unfortunately, sometimes then the bad guys take over the space. And then you have a problem from that perspective. So I don't think anything should go in it
Mm.
except for the obvious. But definitely not like all these products that people are wanting to use that just seem to be a little bit over the top, you know?
Mhm. And in the last couple years, with some of the new things available on the market as well, what is your opinion on things like period panties and the positives and negatives, or even things like the cups, positives and negatives of those? What has been some of your experience of when it's appropriate, when it's not appropriate?
Well, the menstrual cup is really kind of a choice of do you like a tampon, pad, or a menstrual cup? That's different than sort of putting something in there that's supposed to change the environment. So I think a lot of younger women are very astute at the impact of the environment on tampons and pads and the
Mhm.
synthetics that are now placed in tampons and pads. I mean, so many, if you even look at like the major brands, they put so much junk in them now. They used to be cotton only, and now they're
Mhm.
like synthetic sprayed with all these things so it smells like the ocean breeze, right? So it's so much chemicals, and for a lot of women, they're very sensitive to it touching their skin like that.
Mhm.
So I am all for the menstrual cup. I think that's great. I mean, that in general is great for the environment. It's pretty easy. I mean, most women have no difficulty using it, and it eliminates a lot of chemicals that I think we don't need. So I definitely think there's definitely good applications for that, and we're starting to understand too. Speaking of fertility, because you kind of briefly mentioned it, we're starting to understand the impact on toxins and fertility, and the
Mhm.
impact on the amount of toxins we actually, while we're pregnant, are giving to our child. And I think the more conscious women are on using things, like they go to the environmental working group and they can figure out which products are cleaner than others, the better. They're better for their hormones, they're better for their health in general.
I love that. Yes. And I'm so glad we have bamboo products on the market now and just 100% organic cotton products on the market. And yeah, different options for different things to just help us
Mhm.
manage our menstrual cycle. So I love that. Love that input. Um, Going back to some of those symptoms, I know you mentioned discharge and you also mentioned odor. Talk to us about itching because I think that this is something so interesting because so often my patients are like, I was itching. They assumed I had a yeast infection and I was swabbed for it. It was negative. What has been your experience with vaginal itching and things like histamines or other immune activation playing into vaginal itching or even flow?
Yeah, so vaginal itching and vulvar itching are very different because
Mm.
there's quite a few vulvar diseases that are sort of inflammatory by nature. So if you have another inflammation type picture or an autoimmune type picture, you could very well get vulvar itching and vulvar irritation, and that kind of almost coincides with other flares throughout your body, right? You have other kind of autoimmune flares. So there are women who get told, yeah, it's probably yeast because they called into the doctor and said I'm having itching, but never was asked, well, is this on the outside or the inside? Like, what are we talking
Mhm.
about? Are we talking about discharge? They kind of get put on the diflucan train, and then they may have had vulvar irritation from lichen sclerosis or another disease that's autoimmune or
Mhm.
inflammatory, and so then the yeast medicine didn't work because it wasn't even
Mhm.
a vagina issue. Like, they're two different things, vulva and vagina. So vaginal itching, I mean, there are people who get itching because the tissue becomes dry. It becomes, this is very common in perimenopause and menopause where women start losing hormones. And so when you lose hormones, the tissue becomes very thin, very pale. You lose the plumpness, the collagen underneath the mucosa. You lose kind of those ability to fight infection, the immune system regulation, your pH changes, all of these things change, and some women start developing itching as a symptom because it's kind of just irritated in general and not necessarily an infection causing itching.
Mhm.
So mucosa or vaginal mucosa, the tissue inside the vagina, can you can have itching from infection, but you can also have itching from inflammation, and you can also have itching from lack of hormones from it getting so thin.
Mm, so interesting. And I'm glad that you're educating on these various aspects because it often is just kind of a one size fits all recommendation that's given where we do need to be more thorough in advocating for ourselves and giving those specifics of where we're experiencing the itching, what type of itching it is, when it's occurring in the cycle, or specific triggers for it.
Well, even when patients call in or even speak to their physician, making sure that they know anatomy, right? Where is
Mhm.
this, right? Sometimes I hear I'll listen on Instagram or whatever, and someone's like, vaginal this. I'm like, well, that's your vulva. Like,
Mm.
they're too, like, what is the area that we're referring to? Because that really helps with understanding what are we dealing with in general. So understanding your anatomy. I mean, take a mirror down there and look. Start figuring it
Mhm.
out. Where are things? What are the things? And so you can try to figure out if your mom didn't give you that female 101 talk or your sixth grade class or whatever, when they say your body's changing, they kind of give
Yes.
you all those things. So I find women all, like, nearly every day you don't understand what's going on, and so it's important to use the correct terms and to know the terms so that you can get better help.
So important. I know I was so grateful. My daughter is going into fifth grade, and I planned a puberty for she and her friends because in my time, we did not get that education. It was kind of like learning from each other incorrectly, trying different things. And so it's so important. It's so important to be advocates for that, of just females understanding their bodies and understanding what's going on. And, one thing that I'm I know this trend was going around, and I had some of my patients ask me about that because we do have more women speaking up on things like endometriosis, adenomyosis, and some of these pelvic inflammatory conditions. Um, and there was a trend going around, I think TikTok, if you saw it, that women were inserting antihistamines
Mhm.
into their cervix because they were finding that it helped some of their symptoms. What is that connection, if you can speak on it or want to speak on it, between histamines, hormones, flow, pain, and just how histamines play into that? Because we're starting to hear more about histamines in the gut. Finally, we're appreciating that connection. But can you speak to that histamine and vaginal or cervical connection to us?
Yeah, where you see it more often in my world is the histamine release that happens in the luteal phase at the end. So right when before you start your period. So patients will describe this period flu, like they just feel kind of like right before their period, they kind of get like temperature issues. They feel kind of achy. They don't feel good, and it's this histamine release, and it's certainly worse on women who have like MCAS or other histamine instability disorders. I'm sort of making that term up, but you understand what I'm saying. The people
Yeah,
that have
histamine
issues,
intolerance.
histamine intolerance.
Mm.
There you go. And so, yeah, they sort of have this histamine release, and they tend to have this kind of period flu type symptoms where they feel like that their body's been taken over, right? Um, I think, there's, as far as I'm aware, no data that's connected. Like, are they then more adept at getting like infections during that week, right?
Mm.
Or like, could it be we just don't, I think because it naturally leads to someone's period. And a lot of times people who may even be having a brewing yeast infection feel a little bit better during their period because things are kind of being
Mm.
flushed out. I think you would have to almost test women who have these histamine type reactions and know what their vaginal microbiome does in that particular phase. And I think that would be fascinating to understand, do they have this sort of shift that happens because of that? We do know the drop in hormones changes the microbiome in the vagina just like it does in other places of the body, but there's not really been anybody who's honed in on, as far as I'm aware, of studies of like, what does this mean, right? Like, does
Mm.
someone during that time, are they most susceptible to get, say they decided to have sex and like not wash after or something, like what would be the, like, how would that change what happens? Would they be more prone to things in general? Do you know what I mean?
Mhm.
I hear
Yeah.
anecdotally patients will say that to me. They'll say like right before my period, I got to be careful with, what I do, but that doesn't necessarily, I've never seen it from a data perspective that says yes. And I think or I know it's because we really don't appreciate the concept of how the immune system plays
Mm.
into the correlation of your hormones and the microbiome. Like, this is all kind of a relatively new idea that it does anything other than change the immune system, right? So I think that
Mhm.
as we learn a little bit more, probably from our gut microbiome information, we'll be able to apply that to the vaginal microbiome that maybe women are more susceptible to these things at that time, you know?
Yeah, absolutely. And I'm so curious to just see the field growing with information and research in endometriosis, adenomyosis, pelvic inflammatory conditions. There are some really strong studies and there's some great data out there on specific microbes that are more correlated with some of those pelvic inflammatory conditions. But it is interesting how we are seeing a little bit more with histamines as well. And I know for many, many years there, autoimmune paleo was very popular. And so many people were following autoimmune paleo diets. And now I think after we've had several years of people trying it and doing better on it or not doing better on it, we're really understanding there's a strong histamine component to the autoimmune paleo diet because so many of these nightshade vegetables and legumes and some of the seeds that are excluded and nuts are actually just high in histamine. And
Mhm.
so I think oftentimes in that population, I see it being spoken of so frequently that I went autoimmune paleo and it really helped me, or I went paleo and it really helped me. And one, of course, it helped your symptoms. You cut out a lot of processed food and things that are more prone to provoking inflammation. So that right there is helpful off the bat. When you're eating a lot less ultra processed food, you will feel less inflamed and you will feel better and your gut will be happier and your vaginal microbiome will be happier as well. But we are seeing such a strong connection where I know for my patients with pelvic inflammatory conditions, sometimes we just decide, okay, maybe just in that luteal phase, let's eat low histamine and see how you feel and see how
Mhm.
your body's responding to it. It doesn't need to be this all the time type of elimination because there are a lot of very nutritive and very nutrient rich foods that get eliminated with any elimination diet. But sometimes it's just periodical and we just need it for a certain phase of the menstrual cycle. So I'm really hopeful about more research and more data coming out on the microbes and how we can better manage them and just help symptoms as well.
Yeah, I mean, I think we're really now understanding inflammation as the driver for all those that you mentioned, right? So how do you can look at them from an individual standpoint, or you can look at it as how do I lower inflammation in general? I mean, the sort of endo cocktail supplements that you are aware of that patients take is really geared towards lowering inflammation, lowering inflammation, because we
Mhm.
know these implants flare with inflammation, right? We know that the cycle change, especially when you're dropping on the luteal phase, flares these sorts of conditions. So I think that is something very much tied to histamine, very much tied to those people that may be a little bit more histamine sensitive or not. So, and
Mhm.
not surprising, it's just I think there's still a lot that has to be. Well, first of all, there's very not enough women's health research. Like, let's be honest. This is less. I just did a presentation in Colorado last week on menopause, and 8% of the NIH budget goes to women's health research.
Mm.
8%. We're 50% of the population, but 8% goes to women's health.
Oh, my goodness.
So, we have a big problem here. You're talking about a very intricate kind of situation where you're looking at people with histamine intolerance who also have a GYN type disorder driven by inflammation. And it's like, whoa, there's like, we can't even get them to give us a female Viagra.
Mhm.
Like we have so many, it's kind of like we have to kind of get the money and the research to be into understanding women's cycles and understanding these variations first before we can even dive into those more intricate things. And I hope that with the younger generation being so good at online and being able to get what they need, that we'll get some of those millennials to help us kind of push the conversations out, right?
Well, it's a good time for us to be having this conversation because we did see so many fantastic female physicians were petitioning to the FDA to approve
Yes.
testosterone for women and to just change some of the restrictions that they have on hormone replacement therapy. For those who maybe aren't up to date on the news this week, can you give us kind of an overview on what this conversation was about and why it's important?
Yes. So the FDA invited several very prominent mostly women physicians, to discuss three big things. First was the vaginal estrogen has a black box warning. It says that if you take it, you are at higher risk for heart attack, stroke, and breast cancer. That black box warning was put on the estrogen in 2002 after the Women's Health Initiative study came out and said that estrogen causes cancer, blood clots, and strokes. It is completely and utterly inaccurate. Vaginal estrogen is safe for everybody. We give it to breast cancer patients, like to help their vaginal microbiome, to help their vaginal dryness symptoms. And there's been never any study that linked vaginal estrogen to heart attack, strokes, or cancer. So unfortunately, it's 24 years later and this thing is still on there. So one of the things that the wonderful, brilliant women are there to say is this is ridiculous to have this black box warning, because for doctors that are not educated and not aware in this space, they see that warning and they go, oh, nope, you can't have it. Nope. And then the patient sees it and goes, oh my gosh, he prescribed me this, but look at this big fat black warning that says do not do this. So it's unfortunate because one of the physicians there, Rachel Rubin, had done this fantastic study that if you give women who are over 65 vaginal estrogen, you can prevent sepsis. 17% of those women had less sepsis, 51% had less recurrent UTIs, and it would save Medicare over $1 billion in cost savings for women who have some vaginal estrogen to change their vaginal microbiome so they don't get recurrent UTIs, infections, sepsis, and die. So, take that black box warning off. So that's number one issue. The second issue is testosterone. Testosterone has been shown in other countries. In fact, UK and Australia both have their version of the FDA approved product for females. And it has been tried. Many companies have tried to get it through the FDA, and the FDA, for some reason, just keeps saying, we need more data, we need more data, we need more data. So the bar for getting things approved with women is much higher than men. And so the conversation needs to be had. Here are the studies that indicate testosterone is good for bones, brain, muscles, and libido. And here's why this should be an open conversation about testosterone. So both of those were kind of the main drivers. And then the third was really about trying to get more research in women's health and to understand what is the bar again of, what is the options for women to be able to have the conversations with providers.
If we need more data, we need more funding for that data. So important that all females are aware of this. Everyone, females, males, we're all aware of this, that we need more data and we need more safe options, and we need to not be restricted, because we do know UTIs are a near epidemic, especially in the elderly population and those who might not have optimized hormones. So I'm so glad that you were speaking out on this, that it just came to so many of our attentions this week and even prior to that. So hopefully more people are asking their physicians about that, advocating for themselves, pushing for more funding to be approved for this.
Yeah, and it looks like there's a question. Is it okay to answer that
Yes,
question?
absolutely. Yes.
Okay. So it said that they experienced vaginal irritation with daily vaginal estrogen and it eased after stopping. So I will say, remember there was two different types of estrogens that can be used in the vagina, estradiol and estriol. Estriol is weaker than estradiol. Estradiol is the I'm 25-year-old, I feel awesome, things are awesome. Estriol is the weaker version. So there are more than one type of estrogen that can be used in the vagina, and also dosage matters. Oh gosh, I sometimes have it in here. Oh, I don't have it. The tube comes with that lovely mean applicator that I often tell people, don't use that. You know where your vagina is. You don't need to use that terrible applicator. Just put a little bit on your finger and put it in the vagina. So the dose matters. If you're using a full one or small one or a third, you certainly, as your tissue gets healthier and healthier, you don't need as much vaginal estrogen. So women will often use it more often initially and then kind of space it out depending on what works for them. So I was just commenting on her question about breast pain and irritation, and it stopped when she discontinued the estrogen. And it may be that you don't need it, but it also may be that the type matters and the dosage matters.
So what do you do with somebody who has some symptoms like that off the bat? Which type would you say somebody may ask their provider for, or would you say the dosage you want to increase slowly?
Yeah, so the one I was mentioning that was the FDA approved estrase cream. So it's a tube that people can use their insurance for. So some patients that see me want to use their insurance specifically, and that's the one that's approved to be used for the insurance.
Mm.
But the dosage can change if you're using like a pea size amount or, 2 pea size amount, and it can be changed between like, every day to 3 days a week or 2 days a week. So that's something, if you're experiencing symptoms and you started a vaginal estrogen, you need to connect with your provider and they can discuss with you, is it a dosage issue or a spacing issue as well.
Mm.
And then
Mhm.
compounding, right? Compounding, there are many options for vaginal estrogen. You can do combos of just estradiol or just estriol or a combination of both. So there are many different ways you can do from a compounding. You can try something from a compounding perspective.
If that estrase, that estradiol only is maybe a little bit too much initially off the
Mhm.
bat. Okay.
Yeah, and it matters. Like if you're 25 or you're 55, some of this
Mhm.
matters. How much are you making on your own? What are we using it for? Like there's a lot of there's a personalization to it.
Mhm. Absolutely. And how common is it for women who are postmenopausal to experience spotting or vaginal bleeding on HRT? Is that something that's common? Is it very infrequent? What do you do when that's the case for your patients?
So if they first start HRT, it is common to have some, spotting or a little bit of light bleeding if we're still trying to figure out the right regimen, right? If it's the right option or not. If you've been on hormones for a long time, a year or two, and now you're experiencing bleeding, that's not normal. So it needs to be evaluated to see. A lot of times in those situations, it's a mismatch issue. You have too much estrogen, too little progesterone.
Mm.
So you either have to go up on your progesterone or down on your estrogen. So any bleeding that's not associated with just starting HRT postmenopausal, then you need to be evaluated because there needs to be an ultrasound to evaluate what's going on.
And we have somebody on Instagram asking about tips for fibroids and heavy bleeding. And we do know that fibroids can play into heaviness of periods when somebody is in the menstruating phase of their life, but also postmenopausal. Can you kind of speak to both on how fibroids might impact response to HRT, any type of postmenopausal bleeding, and kind of how you manage fibroids with women, and any tips you have on those who are living with fibroids?
Yeah, so fibroids, well, postmenopausal, you should not be having bleeding related to fibroids. The whole
Mm.
definition of postmenopause is no more bleeding because there's not enough
Mhm.
estrogen to really thicken the uterus up to get a bleed. So if you're being put on hormone replacement therapy, yes, you do have to sort of in your mind, your provider should be thinking about the fibroid because we don't want to um, start kind of activating the fibroid. That's not a real word we're associated, but like that's the kind of term I would use is sort of activate this fibroid and cause some bleeding postmenopausal. So you have to think about, and in Western medicine, we don't have these terms. In what I do, we think about this concept called estrogen dominance in perimenopause, where by nature in perimenopause, you typically the ratio of estrogen to progesterone is larger, and so people start getting their fibroids growing. They start getting their
Mm.
more bleeding. They start having irregular cycles. So the most common time of getting a hysterectomy is 40 to 55. It
Mm.
can't be just coincidence.
Mm.
It's
Wow.
because people are starting to have declining progesterone. Their estrogen isn't declining at the same pace. It's slower than their progesterone. And so, therefore, they're having these sorts of, again, estrogen dominance type pictures. But again, that's not a term that's used in Western medicine. It's what we use in alternative medicine, but they don't use it in Western medicine. And so, oftentimes, women will notice, like, I'm starting to get heavier periods. My fibroids were fine in my 30s, but now here I am
Mm.
having heavier bleeds and irregular bleeding. And so, you have to, if they're thinking about HRT, you have to balance the fact they have a fibroid and make sure you're not continuing to allow this thing to get bigger or grow.
Mhm. And I think that there's still stigma around HRT, unfortunately, just because of that study that came out in the early 2000s. I know I hear it from my patients, and I'm like, I'm an advocate for hormones. Talk to your provider who can prescribe them. I'm not one of them, but talk to your provider who can. Can you speak to benefits of using HRT, estrogen, progesterone, testosterone, and then we can put that together as well with the gut because we do know there's some data that shows that there's beneficial changes to the gut with hormone replacement therapy.
Yeah, I mean, I mentioned estrobolome, right? Like the metabolism of estrogen. So, yeah, I mean, gosh, the benefits of HRT. How long do we have? Like in my mind, I mean, what you would, if you were sort of a standard practicing OBGYN, you would tell patients that estrogen is used for hot flashes. It's FDA indicated for hot flashes or vaginal dryness, but there's so many more good things related to estrogen. There's an estrogen receptor on every single cell in your body,
Hmm.
every single cell. So just like I talk about, estrogen in the clinic, I talk about it being a bossy aunt in your family. Like she's involved in everything like she's
I
in
love
everybody's
it.
birthday parties, everybody's stuff. Like you can have a party without your bossy aunt, but trust me, it's not as good of a party. Like
Mm.
she has to be involved. So in relation to, bone health, brain health, immune system regulation, skin disorders. Like when we start losing estrogen, we lose this bossy aunt, and then suddenly everything else goes awry. We develop insulin resistance, high
Mm.
cholesterol, gain weight, our hair falls out. We have suddenly eczema. Where did that come from? We
Mm.
have food allergies that develop. We get bloating. We have vaginal symptoms, UTIs. Like it all just kind of downstream happens. And I'm only talking about one of the three hormones.
Mm.
So for me, there's so many benefits of HRT. Now, is it for everybody? No. Some people choose not to do it. It doesn't align with their moral values, or they don't feel like it's what they want to do. And that's okay too. There are plenty of other options to treat perimenopause and menopause as well. But I definitely think hormone replacement therapy needs to be an informed consent by providers for every woman, and that patient can choose like what is right for them. But it needs to be a conversation, and stop using the excuses like it causes cancer, it causes, like, no, there's so many myths and so much bad information about, well, my aunt's cousin's brother's next door neighbor had cancer, therefore I can't have it. I'm like, what are you talking about? Like, so there has to be much more information about how to get those out. I will tell you that currently there are 13 states in the country that are proposing that people who take care of menopause women need to have education. And I think that's really
Mm.
important, that we need to, as providers, get education about what is actually what we should be talking to patients about, instead of just relying on people to do it on their own. So I'm hoping as more and more people come into this space about hormone replacement therapy, we also will get providers more educated about what to offer their patients as well.
Absolutely. And just in the last few minutes that we have, I know we have about 10 minutes left. Can you speak to benefits of combining estrogen therapy with progesterone? And do you have patients who say, I'd rather not use the progesterone along with the estrogen? Can you speak to kind of what one has to expect, especially if they come into it a little bit hesitant, which again, a lot of women are a lot
Yeah,
of the
so
times.
if you have a uterus, you are placed on estrogen, you have to have progesterone to protect that uterus, because estrogen thickens the lining of the uterus, and if you don't have progesterone to kind of stabilize that, you can then have thickening of the tissue inside the uterus and ultimately have a higher chance of having uterine cancer long term. So if you have a uterus and you're placed on estrogen, you have to have progesterone. If you don't have a uterus, you don't have to have
Mm.
progesterone. I still give patients progesterone, because to me, you can't tell me that a hormone that was so valuable at 25 is now not valuable at 55 because I don't have a uterus. Like that doesn't make sense to me. Progesterone works to help relax your brain, help you get to sleep, stay to sleep. It works with the GABA receptors to help get you to sleep, stay asleep, calms you down. So when you're like, I hate everybody, I hate my husband, I hate my kids, I just want to like kill my coworkers, like you need progesterone to calm you down. When you have heart palpitations because the GABA receptors again don't have progesterone, then people get, this is actually the story of Oprah, because I see this person up here that said, why are so many more people
Mm.
talking about it? Man, celebrities that are my age are like, this is for the birds. Like we are,
Mm.
Oprah this in March launched this menopause revolution. And when Oprah's on board, things happen.
Mm.
When you get
Mhm.
O
That's a powerful
involved,
voice.
things happen. So we're hearing more and more and more information about this, because again, you have Naomi Watts and Oprah and Halle Berry and all these celebrities that are my age we're a lot older than you. So we have these celebrities that are like, I don't want to do this. It's so miserable. And so they're really bringing the education to the patients who are now saying to physicians, hey, I don't want to feel this way. I want some options. So the awareness is
Mhm.
really kind of taken off
Yeah.
because of, I think the people who are being involved. You have physicians now that are willing to go on Instagram and talk about these things, and that makes a difference. So I think patients are realizing, and people are realizing, you don't have to suffer, and there are options for you.
Mhm. I love that. Yes, we're telling the NIH, hold my beer. We're gonna
Yeah.
crowdsource and we're gonna gather data. But I love that. And if those who are listening haven't heard of the M Factor, I know that was a really
Mhm.
great documentary that came out and highlighted so many of these topics and these issues that we're talking about. I really think it should be required learning for all of us, just so we kind of know what to expect, what our options are, what is a misconception, what is true, and what we can be asking our care team about.
Yeah, yeah, and we talked about hormone replacement therapy, but there are a lot of options. There are about nutrition, about lifestyle, about sleep, about, there's so many things that can be dialed
Mhm.
in that changed as well. So it's not just a conversation about HRT, it's a bigger integrative care plan that has to do with those other aspects. Because even if you're taking HRT, if you're up till 2 o'clock in the morning and getting 4 hours of sleep at night, you're still going to feel
Mhm.
awful. You need to focus on those other aspects too.
Yes.
So it's really important to see it as a bigger picture. And when I talk to patients in clinic, I'm like, let's talk about the low hanging fruit first. Like, what are the things, is it
Mhm.
nutrition that we're going to work on first? Is it sleep? Is it, you know, maybe relationships? I mean, what is the thing we want to sort of tackle? Because there's a lot of aspects to that type of care.
So many. And, I would say now we're very well educated on lifestyle, very well educated, or more educated than I think we ever have been on nutrition. Where sometimes, though, I do see my patients unnecessarily suffering, and I'm like, hey, I'm your dietitian. I I do feel like having some help, whether that's a nice supplement that's going to support hormones, or whether that's talking to your provider about hormone replacement therapy, that will help your relationship with food, that is going to help your sleep, that is going to help your stress level as well, because you're putting in all the effort that you have the ability and the financial capability to put in. And so it's always nice to just have additional help where it's available, where you feel comfortable with it. So just knowing the options is the first step, and is such an important conversation for more of us to be having. So I'm glad that we're having that here on Good
Yeah,
Gut
I mean, you're the
Live.
CEO of your own health. So you and me are here to
Mm,
support those patients in their journey. So it's
yes.
about you deciding what's right for you. You are your own doctor, and we're both here to help kind of support you in that journey.
And they should always, always, always feel empowered to hire and fire accordingly. If your provider is dismissing you, gaslighting you, there are so many others who will not. So you are in charge of your health, just like you said. You are the CEO. A CEO would never settle on subpar employees that are running their business into the ground. You're going to hire and fire accordingly, and you should always do
Yeah,
that in
actually, I'm going to change
healthcare.
that to CEO. We are the CEO of our
I love it. So
Since we're
appropriate
talking
for
about
today's
vaginal
topic.
microbiome,
I
it's
love
we're the
it.
CEOs of our health. So we have to make sure we get the credit for
Love
this.
that. Yes, and so many are asking, "Is this gonna be available later? I have to hop off, I have to get back to work." Yes, so this will be available on our Instagram, it will be available on our Facebook, we are gonna put it up on our Good Gut Live podcast, so wherever you listen to podcasts, that will be streamed. I know our time is just about up, but if people wanna follow you, if people wanna find you, wanna connect with you, where can they do that for just education? If they do wanna become your patient, are you taking new patients? Where are you licensed to practice? How can people become more integrated in your
Yeah, so for
offerings?
education, I have a YouTube channel under my name, Dr. Jennifer Roelands, and I publish videos every week, mostly on perimenopause and menopause health. I'm on Instagram, drjen.md, and then I do practice in 11 states. My main practice is in California, in Southern California, not far from you. And I practice
Mhm.
integrative functional medicine, but I also see men because I'm board certified in integrative medicine. So, and then if you go to my website at Precision Health MD, you can actually see where the other states are that I'm licensed in as well.
I love it. And I'll share, Dr. Rollins has recently become a member of my care team. So I'm grateful to have just your integrative insight and helping me figure out my most optimal health. So I have been just so appreciative of it. I know I love to send my patients over, but if anyone else in California is needing a great integrative functional member of their team, I highly, highly recommend Dr. Rollins. And I know there's so
Okay.
much more we could get into. We didn't even dive into Hashimoto's today. Someone's asking about toxic
Oh,
shock syndrome. We are talking about, there's so much that we can talk about. So it's evident that we need a part two to this. We'll have to
gosh, Hashimoto's, we could
schedule
talk
a
for 4
follow up.
different hours about that. That's a very I have Hashimoto, so I love talking about Hashimoto's, but it's very complicated
Same.
situation. But
It
TSS, yeah,
is.
that's
And
something that's obviously related to retaining a tampon too long and the bacteria that's on that particular thing. And so I don't know that, I'm not sure. I think that question specifically says a huge TSS in the past. I think, we have to make sure that we also educate women on how to use tampons, how the proper use of them, because menstrual
mm,
cups, you can use them for a very long period of time, right? You're just switching them out. But tampons really need to be replaced every couple of hours. So I think there's something that's related to TSS
mm.
is really about understanding how to use them appropriately. Yeah.
Just like with any tool, absolutely. And, I think our last comment is a great way to wrap up. Gut health seems to be showing up more and more in medicine lately. I'm really curious how it's going to shape women's health moving forward. I think we all are. There's so many gut to everything connections. And just like you mentioned, the estrobolome, the vaginal microbiome, there's so many connections with your gut microbes, your gut health. We're all working on our gut health. And so hopefully conversations like this either provide you with more answers, provide you with great questions for your care team, but continue to further this conversation so that way we can get a lot more than 8% of the NIH funding
Yes.
going towards women so that we can thrive and we can continue to heal with each
Thank you
meal.
so much for having me. It's been a pleasure.
Thank you. Thank you for being here. We look forward to next time. I know definitely our population appreciates these conversations. I think just women and those who love women in general really appreciate these conversations. They need to be had more. And if anyone has any additional questions, we can always answer those after the fact. So
Thank
thank you
you.
again, Dr. Rollins, for your time, your expertise, your passion, and just for all that you do. For everyone listening, we hope that you have a wonderful rest of your day, a wonderful rest of your weekend, that this topic and conversation encourages you to heal with each meal, feel with each meal, and just continue to be well from your head to your gut to your vagina to your toes to everywhere else. So thank you to all. We will